Nunavut's Department of Health is a territorial government body that serves all the residents of Nunavut. In particular, this proposed intervention plan focuses on residents of Nunavut that smoke on a daily basis. In 2019, Nunavut had the highest prevalence rate of smoking in Canada. The average prevalence rate of smoking in Canada is less than half the prevalence rate of smoking in Nunavut. To reduce both the prevalence and incidence rate of smoking in Nunavut, the Department of Health is currently working with Health Canada on a campaign called the Tobacco Reduction Framework for Action. This campaign started in 2011 with the goal of reducing the prevalence rate of smoking in the territory to 53% of the population. There has not been any time limit imposed on this campaign, so the intervention plan that I'm proposing builds off of this current initiative. The campaign has introduced a youth-based school curriculum that educates teenagers on the health risks associated with smoking. Contrary to the results the Department of Health aimed for, the prevalence rate of smoking in Nunavut has not yet reached 53% of the population since the start of the campaign. Rather, the prevalence rate has fluctuated without any trend during the years before and after the Tobacco Reduction Framework for Action was initiated. The Center for Addiction and Mental Health suggests that a contributing barrier for why there is no steady decline in smoking prevalence is that nicotine replacement therapies are not commonly accessible in Nunavut. Nicotine replacement therapies, which are abbreviated as NRTs, include nicotine patches, chewing gum infused with nicotine, and inhalers. They reduce cravings associated with tobacco withdrawal and have been shown to increase the chance of quitting by up to 55%. In fact, all Canadian Inuit registered with Indigenous status with the government qualify for the Department of Health's non-insured health benefits program that provides an approximate 5 months per year supply, each of free nicotine-based gums, lozenges, patches, and inhalers. Currently, only 38% of Inuit smokers in Nunavut are using NRTs. NRTs are rarely accessed by Inuit smokers in Nunavut, possibly because they are distributed via community health centers throughout the territory, and the majority of workers in community health centers are non-Inuit Canadians that neither speak Inuktitut nor are familiar with Inuit culture. In a survey across 20 community health centers in Nunavut, more than half of Inuit patients reported that they felt uncomfortable with the care and instructions they received from non-Inuit physicians and nurses because they were unable to understand cultural norms and medical instructions in their healthcare settings. This may include instructions regarding the availability and benefits of using NRTs. This is possibly why the Office of the Auditor General of Canada suggests that Inuit may be able to better understand the short-term benefits of using NRTs to quit smoking if there are no language or cultural barriers preventing them from understanding the implications of using NRTs. Thus, the intervention plan that I propose is a two-pronged approach aiming to support the current Tobacco Reduction Framework for Action in order to reduce the prevalence of smoking in Nunavut to 53% of the population or below. As 57% of Nunavut residents speak Inuktitut as their native language, and 5% of the population only speak Inuktitut, the first step is for the Department of Health to preferentially employ at least one bilingual, meaning English and Inuktitut speaking Inuk, to distribute NRTs at each of the 55 operational community health centers in Nunavut. Setting a hiring quota for local bilingual Inuit may help reduce cultural and communication barriers between the hired employees and Inuit patients in the hospital that smoke on a regular basis. Furthermore, it may help decrease the Inuit unemployment rate of 20.8% of the population to a number closer to the non-Inuit territorial unemployment rate of 3.9% of the population of Nunavut. The second stage of this intervention plan is for the Health Insurance Programs Office of the Department of Health to train these bilingual candidates so that once they are hired, they are properly educated on the non-insured health benefits plan and the implications of using NRTs to help quit smoking. Funding is needed to train and financially compensate these newly hired employees. This training can be funded in part by the annual $2.02 million in uncapitalized grants provided to the Department of Health by the Government of Canada. Since 2017, these grants have been used to encourage Nunavut residents to cease smoking by providing monetary gifts to those that have quit smoking over the most recent fiscal year. However, as the smoking prevalence has not decreased to the target prevalence rate of 53% of the population, it's suggested that the Department of Health invests these grants into hiring, training, and providing income to the bilingual Inuit employees that are interested to learn more and educate others on the implications of using NRTs. The competitive advantage of this intervention plan is that funding for NRTs is already provided by the non-insured health benefits plan. Additional funding can be provided by numerous government grants designed to improve population health, education, and provide labor opportunities for residents of Nunavut. Furthermore, smoking-related illnesses such as lung cancer and colorectal cancer are the primary cause of medical evacuations in Nunavut, with 63% of all medevacs related to smoking. A large contributor to the high number of smoking-related medevacs is that there are no oncology or radiology facilities in the Central Hospital or any of the community health centers in Nunavut. If this intervention plan can help reduce the number of smoking-related medevacs, the government of Nunavut can save up to $64.9 million of the $176.8 million annual expenditures used for medevacing patients from Nunavut to hospitals in southern Canada. The Department of Health may then use these unused funds towards expanding current health interventions or developing new health facilities that will help improve the health of residents of Nunavut.